welcome, and thank you for looking at our 282 in the 603 resources.
My name is Ellen Desmond, and today, along with my Bureau of Student Wellness colleague, Lisa Hayward, we're going to introduce you to RSA 193J, the Suicide Prevention Education Law that goes into effect July 1st, 2020, and we're going to talk about its implications for New Hampshire school districts. So state-level stakeholders have come to the table together to coordinate the ways that we want to support New Hampshire schools and other child-serving organizations with suicide prevention education programs and practices. So we're simply just this collection of partner organizations with a common goal to eliminate youth suicide in New Hampshire. And we've dubbed this initiative 282 in the 603, and it's an initiative to bring suicide prevention training to New Hampshire schools and their community partners. So Lisa, why the 282?
Well, that's a great question. It's a Senate Bill 282, and it was signed on August 2nd, 2019, so a while ago, by Governor Sununu. And the purpose of the law is to reduce the number of suicides in the New Hampshire school population by ensuring that suicide prevention education and training is available to all school personnel, students, and their parents and caregivers using age-appropriate and evidence-based materials. It applies to New Hampshire school districts and New Hampshire public charter schools. So Ellen, I know you want to talk a little bit more about a really innovative initiative.
Yeah, so let's dive a little bit deeper into what the law actually says. By the way, just a note, you can find all of this on our Office of Social and Emotional Wellness Technical Assistance Guide that the department put out. So all of this information is in print form if you want to take a look at it. So the charge of this law, as Lisa mentioned, is for New Hampshire school districts and public charter schools to develop a policy that includes the following provisions. So the first thing is training for faculty, staff, and school volunteers. That's every adult in the district community. So every adult in the building should receive 2 hours at minimum per year in the following areas: youth suicide risk factors, suicide warning signs, protective factors, response procedures, so in a crisis situation, a process for referrals for students for either in-school mental health services or with community partners. And then post-vention, in the event that there is a suicide in the community, post-vention resources and a protocol to make that available to the school and the community. Another part of the law is to broaden the student education portion. So educating students in safe and healthy choices and coping strategies, recognizing risk factors and warning signs in themselves and in peers, and then providing help, seeking strategies, including how to engage school resources and refer friends for help. So educating students on kind of what that protocol is if they are concerned about themselves or others. Another piece of this law is to identify a point person. So someone within the school, or ideally several people, right? Because we want to make sure that there is a feedback loop, there's clear communication within a school district. So that person would serve as a point of contact when a student is believed to be at elevated risk for suicide. This policy also needs to cover making referrals, crisis intervention, other related information, both within the school and within the community. Taking that information, making sure that it's available and clearly communicated to all stakeholders, so students, parents, faculty, staff, and school volunteers. And then this policy also should promote cooperative efforts between school districts, public charter schools, and community suicide prevention program personnel. And we are really lucky that we have some great stakeholders in the state that provide suicide prevention programming. So Lisa's going to chat a little bit about that.
So we're not endorsing any particular program because we recommend and we understand that depending on your district, your budget, your student population, the ages of your students, the diversity of your students, and staff and faculty populations, there might be multiple things for you to consider when you pick what the type of training that's going to be the best fit for you. But we have compiled a list of possibilities that you can read about and you can bring back and you can discuss. If you have additional questions, you can reach out to some of these partners, talk to them about cost, about schedule, about population, and ultimately find one that works for you and that meets the needs of your communities. So we encourage you to look through the menu, to reach out to them, check out their web pages, watch the little overview videos that they've made about their training opportunities, and then make your decision. If you're a training partner and you want to be added to the list, by all means, reach out to Ellen Desmond and myself at the DOE, and we'll walk you through the very simple steps of being added onto this list of possible training partners with us. Thank you for joining us on these pages.
Yeah, thanks for tuning in. Be sure to check out our suicide prevention web pages and the 282 and the 603 playlist on our YouTube channel for a glimpse into the trainings that are offered throughout the Granite State.